Hello, hi, I'm Erik Leong from Osteocare 𝙏𝙤𝙧 𝘏𝙤. Today I'm going to talk about lower back pain, sciatica, and work-related injuries. Okay, basically lower back is a very mobile in our body. You can bend forward, you can bend backward, side rotations, and left to the right. This is like very mobile, so it's very easy to injure. And then not only you carry the heavy load and then you might get injured. Sometimes in static position you sit too long, it might cause that too. That is due to the spasm of the muscles. Once the muscle is spasm, it relates to the bones. And then to prolonged sitting or prolonged static positioning, the muscle will be spasm and it pull and it accumulate and make the bones out of alignment. Okay, let me show you how's the lumbar look like. Okay, lumbar, we call it lower back. This is what we call the sacrum, the lower back of the buttock, and it's all connected with the two eyelets. They call it a pelvic. So this is 5, 4, 3, 2, 1. This is the 5 segment of the lumbar. Lumbar is very mobile, as you can see. You move and the side, bend forward, all that. And that is a locking mechanism. When you carry heavy load and you bend down, these bones will move up and you do rotation, and then without proper lifting, it will lock. This is how it looks like. So it might be very painful, or it might be just only a little bit painful, and then prolonged, it will get the sciatica problem. So if you don't do adjustment back on it, it will suffer in the long term. How it goes. So whenever it's locked in this position, it will develop the stretching of the upper bones and the lower bone. It compresses the disc and it becomes a slip disc. If the disc is slipped towards the frontal part, you have no worry. To the side is no worry. If you go to the back, you start to think about it. This is the nerve that is connected to our body, our leg, especially. Once you get this compressed, it will produce the refer pain down to the little toes. That very irritating when you walk and you travel or you sit. The sensation will be like burning, sometimes twitching position. So to explain it, so what will we do with that? So normally we will do adjustment on it. When you lie down sideways, we will have a technique to go with the flow with your bones, and then we stretch it out, and then we, with a quick adjustment, you pop, go in and go back in this position. Okay, sound easy, but it needs years of training to do this. This is a basic knowledge of the structure of this lower back. Once you adjust it back, you have to be alert of the muscles. The side of this muscle, I call it, in a layman term, they all call it a fillet. It's a layer, not too thick and not too thin. There's a layer of the muscle. So you need to relax this muscle, so this will gain back the motions. How you get lower back if you get prolonged situation? What will happen? This is the healthy segment of the lower back. You see this is the disc, this is the nerve, and this is the vertebrae. This is healthy, and then we will see this herniation disc. The disc herniation, when the upper body of the vertebrae and lower body of the vertebrae it being compressed, it's like lifting heavy pot, like a flower pot or something heavy, and sudden rotation. Once it rotate, press, rotate, you will get herniation disc. This is how it looks like. This is the nerve travel down to your leg. That's why we call it a refer pain. This is touching, some is touching, some is pinching. So this is called slip disc. And here written here is herniations of the disc. Once the disc is herniated, it's very hard to put it back. You need to relax the muscle. Sometimes you need to do a lot of acupuncture, you need to do a lot of massaging. But of course, you have to put back in position first, see how the vertebrae goes. Okay, for the inflammation herniatus disc, we also call it a disc bulge, slip disc, spondylitis. This is a general term, okay? This is what you see in the x-ray or report, okay? If let's say you ignore herniation disc and prolong, you will get bone degenerations and the disc degeneration. You see, just now this is the disc being herniated. Now this is due to the bone. This is called spur of the bone. This is spur, and the narrowing, what the MRI report normally said, narrowing. This is how it shows like narrow, but you still have the disc but narrow. Bone and bone touches will be very painful, and sometimes those people are very athletic, they won't feel the pain. This joint will fuse together, 2 into 1. Okay, this is the and the advanced problem with the disc is the advanced osteoporosis. You got herniations of the disc, you got the depleting of this herniation disc and deplete and narrowing, as well as you see this bone bring osteoporosis and bend and the spurs coming out and spike. Not only the disc will touch the nerve, sometimes these spurs will touch the nerve too. The doctor will normally do a surgery to shear it off and then have a special technique to open up. It might be fused together. Both also works well for the patient. Whichever techniques, as long as the patient get better. This is the lower back information for you all. Thank you.